This is the largest independent aesthetic conference in North America because of the amount of lectures, the quality of the faculty, the diversity of lectures, and the fact that it's multi-specialty.
But when you come to a meeting like this and you bring together world-renowned experts in the various subspecialties in a multi-specialty manner, you have the opportunity to hear what's state-of-the-art from people that you trust and respect, and it definitely alters the way that we practice and the way we treat our patients.
We all have a lot of overlap in what we do. We all trained in completely different areas, so our background in residency and fellowship has all been completely different. And I think it's really important with that overlap to learn from each other.
None of us has all of the answers. We always know that we can learn something from someone else in another specialty who has perhaps a different background, and in their daily practice they do things differently. And you sort of cull out the things that don't work and you focus on the things that do work.
At this very meeting, you had the presidents of the ASPS, ASAPS, AAFPRS, AOHNS, Derm Society, Derm Search Society, Oculoplastic Society, and Ophthalmology. All 8 people in the same room at the same conference table. That has never happened before, and it's only because of VCS.
It's satisfying teaching one fellow or one student, but there's nothing like participating in the process of elevating the entire specialty. And I think that's what drives those of us who give up a lot of personal time, a lot of other things we could be doing to keep coming back year after year.
I've just been proud of the exchange of ideas because, if you're doing volunteer surgery, which I've done many, it stops with the patient. But when you can share ideas and the person can take the ideas and improve and bring them back, it helps the patients the most.
As an aesthetic physician, I find that this meeting is, I've called it my Sistine Chapel in the past because there's such a great wealth of knowledge and great lecturers and attendees.
Each year I've brought more of my staff. 2 years ago I brought my media director, last year I brought my office manager, my media director, and this year I also brought my PA. But I think what's been great is we've been able to take what we've learned from this meeting, both from a surgical and procedure standpoint as well as from an office management standpoint, take that back to Tampa, and we've been able to integrate that into our practice.
It was a meeting put together at the right time by the right person with a vision, with the right ingredients in terms of what the content is.
The portions that are new in terms of techniques and in terms of technological advancements, which are many in this day and age, this is the place to see them first. This is the place to have lectures on them first, and this is the place where the exhibitors display those technologies first.
People who have been influential in the genesis of this meeting, not just me. I'm just one person that kind of pulls everybody together. So I'm the choreographer, but I have a lot of dancers and actors, and all those people just really are responsible for that success.
Clearly this is the crux of where we're going. The future of aesthetic medicine is no doubt the aesthetic bodies coming together. We all know it, it has to happen. And what Randy's done is, it's not just put together a meeting, but he's actually initiated a new movement, a new way of thinking in cosmetic medicine and plastic surgery and aesthetic medicine.
In 5 years, I have seen this conference grow from just several hundred to several thousand. It's just an incredible conference that gets bigger and bigger every year. There's more vendors to display newer products and services every year. There's more attendees every year, and there's more practice management lectures each and every year as well. It's never going to get too big, it's only going to get better.